Heel lifts are one of the most common additions used in the treatment of foot and ankle pathologies. It can be used to offload a painful Achilles tendon, plantar fasciitis, a leg length discrepancy, or to activate the windlass mechanism. The interpod heel raise is easily adhered to the base of footwear or the plantar surface of your orthotic by peeling back the adhesive cover. If the heel raise is adhered to the base of the footwear, the patient's orthotic may be placed over the top, or adhered with double-sided tape or Velcro to avoid the orthotic moving. The metatarsal dome is a teardrop-shaped pad which sits underneath the forefoot. It is designed to lift and spread the metatarsals upon weight bearing, and is an effective treatment option for a Morton's neuroma, a functional hallux limitus, or when relieving forefoot pressure areas. It is easily attached to any orthotic by peeling the adhesive backing and placing the dome so that the distal end sits 1 to 2 centimeters over the distal edge of the shell. Too far back from this and it may irritate the plantar fascia. Too far forward and it may provide discomfort for the patient. To ensure the device is in the correct position, place the orthotic against the foot and ensure that the device is comfortable and achieving the desired result. If your patient requires more forefoot control or pressure area offloading, you may wish to adhere a forefoot Varus or Valgus Pad to your orthotic. The forefoot Varus pad aims to provide support for a forefoot varus deformity with little or no compensatory pronation occurring. The padding will bring the ground up to the level of the foot to aid in stability and comfort for the patient. The Valgus Pad aims to provide a pronatory force to the forefoot. It is commonly used for patients with reduced mobility of the hallux and to encourage the windlass mechanism. It can be used effectively by adhering to the lateral and distal borders of the 3/4 length shell, with the highest point under the 5th metatarsal. Once adhered to the orthotic, ensure that the addition is in the correct location by placing the device underneath the foot. The padding should sit proximal to the metatarsal phalangeal joints in order to encourage more plantar flexion of the first ray. A rear foot varus or valgus wedge is a common addition added to orthotics in order to increase the control achieved at the subtalar joint. It is commonly used for patients who are still excessively pronated while in their orthoses and suffering from lower limb injuries, such as shin splints or plantar fasciitis. The interpod devices are designed with an intrinsic rear foot post to prevent excess rear foot pronation. The higher arch orthotics have greater rear foot control, and the interpod modular can be adjusted to increase the rear foot control by inserting a higher base insert. The metatarsal bar is a long rectangular pad which can be easily modified to suit your patient's foot shape and size. The Met bar, when placed on the orthotic, can be used to add stability to a foot which displays large amounts of transverse plane motion. Alternatively, it can be placed between or along the metatarsal shafts to raise and splay the digits to help offload a painful neuroma or forefoot bursa.